Hi guys, it's your girl. So I'm coming back at you guys with another CNA video, and this video is called What to Expect on the Job. So I just want to talk about what to expect in these different types of facilities that you might work in. Okay, I want to tell you what to expect in the assisted living facility. I want to tell you what to expect in the convalescent home. Let's just say skilled. I want to tell you what to expect in a rehabilitation place. I want to tell you what to expect on a long-term, Alzheimer's dementia unit. I want to tell you what to expect on a lockdown psychiatric unit. Okay? Okay, so basically we'll start with assisted living. Okay, guys, if you work in assisted living, what you should expect is a home-like setting. Although a lot of places nowadays are, even like the convalescent homes are becoming more home-like as much as they possibly can without that sterile hospital feel. Assisted living does it like no other. A lot of times in assisted living, they have their own apartments, which are awesome. I worked at this place that had it was a beautiful community. You're talking about pools, you're talking about spas, you're talking about workout rooms, you're talking about beautiful dining halls. Assisted living places are nicer and beautiful, but assisted living caters to an the geriatric community that can still do a lot of things for themselves. Hence the word assisted living. Sometimes if you go to a smaller community, you'll have the administrators accepting people who need a little more help, whereas a more seasoned CNA might come in and be like, this is not assisted living. Like, why am I lifting so much? Why am I feeding? Those things are not supposed to happen in assisted living. You're not supposed to be feeding someone in assisted living. Feeding someone is a skill, and you all remember that from your skills that you did in school. You have to make sure that the spoon is like halfway full, and you put it in their mouth, and you let them chew it, and you maybe give them two bites, and then give them something to drink. That's a skill. If I have to physically lift you, if I need a gait belt to transfer you, then you're not really assisted. Assisted living is me either prompting you to do it. Okay, Mrs. So and so, can you stand up? Or maybe like I just grab your elbow kind of thing and help you up. I shouldn't have to be lifting and struggling. You shouldn't. There shouldn't be any equipment in assisted living. Usually, 90% of the time, like there shouldn't be a Hoyer lift. Where's their Hoyer lift? This is assisted living. Hoyer lift means your total care. Okay, but I mean, it just depends on who they admit. You never know who they admit. So, but assisted living should be pretty easy. A lot of assisted living places do not have nurses. If you're a CNA, be careful for that. If you go on an interview, in assisted living place, well, do you have a nurse on staff? Do you guys do in services? Because that's if you working at an assisted living for 2 years and you're not under a nurse, then who is teaching in services, then it's like a waste of your time. You'll lose your certification because you're not under a nurse. You need to work in a facility that you're under a nurse, a registered nurse, a LVN. You know, it has to be a nurse that you're working under. Hence the word nursing assistant. Anyway, on to skills. Now, skills is different. Okay, skill can be in a convalescent home. It can be in what they call a healthcare center. It could be whatever rehabilitation. That's skilled. You're going to use your skill. Those 32 skills I think there are in total. You're gonna use at least 25 of them. Okay? You're gonna feed, you're gonna assist to walk, you're gonna transfer, you're gonna use your skills. They need extensive help. You're going to be cleaning out catheter bags. Your patients might have feeding tubes. I'm sorry, feeding tubes and stuff. Feeding tubes. They might have and while I'm on it, you can have a feeding tube. They can choose to have a feeding tube either in their stomach or in their throat. Most people have it in the stomach. But feeding tubes, tracheotomies, prosthetics, that type of thing. Things that you need to help them with. So a skill place, there's going to be RNs, there's going to be LVNs, there might even be nurse practitioners, there's going to be a doctor on staff. It's the run of the mill. It is the closest thing that you'll get to a hospital. And in a hospital, you're going to have doctors, nurses, medical assistants, you name it in a hospital. You've been to a hospital, you know how that is. Okay? In a skilled facility, CNAs are very, 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 very important. In a hospital, CNAs are important, but not as important as the RN or the LVN. The LVN is usually your boss in skill. Okay? She is your boss. She tells you what to do. You need to do it right and correctly, and you need to report everything to her because you are working under her license. Okay? I gave you a gamut of the things that you'll do in skill. Can I just go into rehabilitation places? Because there are some places that are strictly physical therapy driven, okay? Where you are getting back. They are basically have patients that have had strokes, heart attacks, you name it. They're getting back. So they're learning their mobility skills again. There are some places that are strictly rehabilitation places. Those places are also going to have RNs, LVNs, physical therapists play a pivotal role, okay, and the CNAs. Okay, and there are physical therapist assistants also in those types of settings. So you're safe if you're at a healthcare center. You're safe if you're at a hospital. You're safe if you're at a skill. But assisted living, you need to ask those questions and find out. As I'm getting older, I started out in an assisted living place. My first paid job. So, and they didn't have a RN. So I wasn't working under an RN. So that was a problem. That's one of the big reasons why I had to leave there. And but the thing about an assisted living place a lot of times is you can learn a lot of the other trades. You'll get the makeup of a facility because they might have you doing some things that an LVN do it. Like me, for instance, I know what an LVN does. I can give treatments. I can, whether it be wound care, breathing treatment, skin topical things that the nurse is supposed to do in a skilled situation. But in an assisted living place, you're not going to be referred to as a CNA. You're going to be a caregiver because an assisted living is non-skilled. Okay, you don't have to be certified to be there. Just to let you know that. What else do I want to talk about? Union jobs versus non-union jobs. This is very important, especially if you are looking to make money. Okay? Should I go into it, or maybe I should talk about it in another video? I think I should talk about it in another video because when you're not in the union, you will be surprised that these places will try to pay you $11. Are you kidding me? Do you know how much money it costs to take care of these people? Do you know how much money that these people are paying to live in these places? And you think about the small percentage that you're getting. If they're not paying the CNAs good, then more than likely they're not paying the LVNs good. If they're not paying the LVNs good, more than likely they're not paying the RNs good. And you're going to have a lot of unhappy people. If you're getting paid a decent salary, you'll be a little more happy. I don't know what goes on in places outside of California, but California has a high cost of living, so you're going to get paid a little more. But there are places that try to play you, and they want to pay you $10.50. First of all, I cannot survive on that. You have to keep trying to do better. Even if, to me, you in another state, and let's just say they start off at, somebody told me, I think, 8 something, which kind of, so sorry, boo. So sorry, boo. You know what I mean? You might want to relocate. You might want to go somewhere else where they're going to pay you more because you work hard. I mean, just think about the things that you have. Y'all know how I feel. Don't get me started on that infection control. So don't get me started on those pathogens that are flying everywhere that you are exposed to. Don't get me started on the back pain that long time. You talk to a CNA who's been a CNA a long time, they're going to tell you they got some pain. somewhere. They got some shoulder pain, they got some back pain, they got some knee pain, they got some leg, something. Because you cannot just do this job for so many years without having pain, because, I mean, you just pushing and pulling and tugging, and a lot of places don't have the proper equipment. You know, you got the places who have the old beds where you got to crank it up. Like, that in itself is hard on you. You know, thank the Lord when you have a electric bed that raises up and down like they use in the hospital. You gotta get them nursing homes. You be having to crank them beds, and I mean, you know, a lot of times the patients are real stiff, so you trying to get them to come forward, they pulling back. So I mean, it's like dead weight a lot of times. So you need to be paid for that, and let alone all the stuff that you know are, you know. It's a dirty job. It's definitely a dirty job, but it's rewarding, and as a CNA, you can touch so many different things. You can work with children. You can work with the elderly. You can work with cancer patients. You can work. I mean, you can work in so many different fields. It can be so rewarding, but you have to keep hustling. You have to keep moving. And you know, I'm on this thing with y'all. You know what I'm saying? You might bump into me, be like, "Oh, that's that girl from YouTube. What's up, girl? Well, what's tea?" And if you ever meet me in person, if you ever meet me, the things that I have not said here. Okay, because I'm keeping it 100 on this YouTube channel, but I'm gonna keep it 1,000 if you run into me. You know what I'm saying? I'm gonna tell you what you know what I'm saying. I'm gonna game you all the way up. You know what I'm saying? From people be. There's even complexes with people you work with that you'll see a lot of the older CNAs. They be straight thinking they nurses, like for real. No, you're not a nurse, honey. Relax. I stay in my lane. I'm in it to get paid, and I'm gonna treat you like a human being. What I try to do is I try to look at my patients as people. And it's hard to do. I'm not gonna lie to you. It's hard to look at these people as patients because you have so many patients and you're busy and they doing stuff and da 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 da. It's hard, but I try to look at them as human beings. If I look at them as human beings, then we're gonna be alright. We're gonna be cool. We're gonna be to the G. Okay? But the minute that you go kind of go into the robotic field, which will happen, don't ever get it twisted. Especially when you got a gang. Don't have a high volume. It's called let me do my rounds and let me go. I ain't got time. But if you have the time to talk with somebody and laugh with somebody, or see who they is or meet their family or whatever, then that's a different story. And don't get me started on the family. I'm going on, this video is getting too long. I'm gonna come back at y'all and do another video about families and stuff and how they be, whatever. Families are cool. You love your parents or whatever, but I'm gonna need you to relax. For real. But anyway, guys, it was good seeing you all. It was good seeing you all. It was good talking to y'all. And if there's anything you want me to talk about, let me know. I need to do a video about unions. I really need to go touch in on this subject because let's just say this: you have the right to form a union. So see about working at somewhere that got a union, because you're guaranteed to get it. You're gonna get paid again. They gonna have to give you a raise. Don't get stuck at these places that want to pay you, $10.50 for your entire career. So anyway, I was looking. Dr. Phil's on the background. Her hair was bad, honey. This little lady was on there with some bad hair. And I was like, oh, hey, what's up, girl? So anyway, so I'm gonna say for now, I gotta go try to figure this hair out because it's freaking me out. Like right now, look, I just gotta. You can't even see my part. My part is not even pronounced. I can't even understand it. Y'all don't care about that stuff though. Y'all with me for a different reason. So, I'll talk to you all later. Peace and hair grease giveaway coming up soon. Bye, guys.